All right, welcome back to the Lightning Step Couch. My name is Benjamin Turner, Behavioral Health Advocate. I'm sitting with David Burke, the founder and Chief Marketing Officer with New Start Recovery Centers based in California and Nevada, correct?
Yeah, New Start Recovery Solutions.
New Start Recovery Solutions.
Yeah.
Thank you. David, thanks for joining us on the couch.
You're welcome.
Can you tell us a little bit about yourself and a little bit about New Start Recovery Solutions?
Sure. My name is David Burke. I'm the founder of New Start Recovery Solutions. Chief Marketing Officer. We're very passion-driven, family-oriented, treating the individuals and the whole person.
Awesome.
Some of the things we really specialize in is, I would say, the detox, the residential. We do have primary mental health as well. All levels of care between outpatient, day treatment, individual counseling.
Yep.
We do marriage and family therapy as well. Our alumni program's really robust. We have probably over 400 enrolled as we
amazing.
speak.
Yeah.
One of the things we're really proud of is our Wellness for Warriors program. We have like a veterans ranch up by Chico, California, on 23 acres. So we're really proud to be serving the people that serve us.
Awesome.
We do have attached to it our first responder program. So early in my career, I used to do a lot of supervision in the treatment courts and stuff like that, in the mental health courts. So we do a lot of advocacy about veterans or anybody that's struggling in mental health or anything, like with the diversion programs.
Yeah.
So as far as the 12 core functions in like the drug court modality, is what really sparked my interest to being a national and international interventionist. So one of my passions, which one of my mentors said never to lose, is what brought me into business.
Absolutely.
So I still very passionate about working with families. I still answer the phones and kind of walk through the crisis intervention, whether it's a first responder, a veteran, or anybody could be homeless or anything like that. So we have a lot of avenues, a lot of paths, and there's always like one destination we believe in for treatment. So we're really in our mission statement, it says as well as like nobody really gets left behind.
That's awesome. Now, the first responders and veterans community really needs support, really should be lifted up. And so really glad that you're providing those services. I do want to talk a little bit about, you'd mentioned some primary care services. So what are some challenges or what are some barriers to integrating primary and behavioral health care, and how can those be overcome?
So I think one of the barriers would be maybe in society at large, since there's so much technology and everything, some of the communications getting out to individuals and their loved ones seeking a better quality of life. The barrier might be, times have changed a little bit. I've been doing this for a little bit of while. So some of the stigma that might be around it, especially in our younger adults, some of their urges, desires, the feelings, emotions, and actions they have, what it is the communication piece. So how do we relate to them? Because there's a new society, a new generation coming up without losing the traditions of the old generation. So example, being culturally diverse, working like with a Native American community or something. How do we embrace the elders at the same time, having somebody that's from the X generation coming up? Well, that would be education.
Absolutely.
Educating systems, not really changing them, but be like a spoke in the wheel of implementing, a return to work order, whether it's with like within a system like a rancheria, creating a behavioral health system, or maybe a second chance program. We do that a lot with different agencies around the United States with first responders.
Yeah.
So another barrier would be just the lack of resources for people that really come in. And we do have a nonprofit at our agency called the Elijah House. And we serve people that can't serve themselves or don't have the resources. So we have a back to work program. You see those on the side of the road, you see the Caltrans and everything. Well, we have vans and going all the way from like Oregon down to Monterey.
Okay.
We're located in Monterey. We're located in the East Bay. We're located for programs in Sacramento. We're up in Chico and Reno. So we do a back to work program. When people step down into our outpatient day treatment, they can actually apply and go into like case management, money management. When the fires broke out in Northern California, we had people working on the fire abatement. We also have a trucking company that people can go to. So it's, a failure to launch after treatment,
Yeah.
but also we follow people for 18 months, and they are a lot of people get mentors, but they get case management, and through our nonprofit, they also qualify for like some medical services and
Mhm.
outpatient.
Okay. Okay. You mentioned that you have a very robust alumni program.
Mhm.
How do you maintain that alumni program, and why do you see so much success within yours?
So I would say our alumni program is what we do is so we do the biopsychosocials up front when
Hmm.
they come in, do the
Sure.
assessments and stuff. So we get a kind of a little like doing like a geneogram of the background and some of their intergenerational patterns and stuff like that,
Absolutely.
and so when they come in, what we like to do is very well as introduce that to them when they first come in, saying, "Hey, we're in it for the long haul with
Yep.
you. We're going to support you through this. We're not going to figure it all out today,
Yeah.
but we're going to get you through it." And then, so along with the alumni program, when they step down into the last couple weeks of our residential and everything, we introduce them to that. We have our own personal app through New Start Recovery
Okay.
Solutions,
Okay.
so they can download that,
Yeah.
and it's basically a wellness program at that point. And so what are my intentions for the day? What do I get? I don't have to relapse or work a relapse prevention. So this is what it looks like. Just today is, what the first thing I did is I waked up clean and sober. I checked in with my sponsor. The app reminds you of the quote of the day and everything like that. You
Yeah.
can read it, respond to it. It also has a schedule for your treatment plan and aftercare, the step down program, or way back if you relapse. So, and we talk about that when you're getting out of treatment. What do I do? In the old days, they'd carry around trigger cards, but we have
Yeah.
technology today,
Yeah.
and so they can whip out their app and text straight to our admissions and say, "Hey, I relapsed. I just need somebody to talk to. I don't know if I'm ready to come back." But and also what we like to do is we educate around suicide. We educate
Yeah.
around, okay, so maybe they had just lost a loved one. There's a place on the wellness app to go, okay, here's what I do. I don't need to figure it all out now, but I feel safe by chatting and talking about it.
Yeah.
Then we'll say, "Hey, are you willing to be open for a call?"
Yeah.
We'll meet them at their level.
Hmm.
Sometimes grief can really dictate, the windows coming in on
Absolutely.
people. So we're really proud to have our alumni with our Wellness for Warriors program. We do a lot of advocacy for the homeless veterans, so we come together. There's a lot of strength in
Yeah.
numbers. And so what we do also is we educate other systems, or maybe we, like state of Oregon or places where there's no resources. I just came back from there and I flew in there, met with the homeless, met with the Victory Outreach and a lot of the players that
Hmm.
work in the Veteran Association to build resources there. And we actually provide the transportation for them to get out and get into detox,
Hmm.
but also build up the systems there.
Yeah.
And so we know virtually they can tend to us, but our alumni program is kind of portable to educate other peoples in other communities and states, saying, "Hey, we can help you build out something that's going to support you."
That's amazing.
Yeah.
Yeah, there's no doubt that technology can play a really effective role in alumni care
Uh
and
huh.
keeping them within the organization and keeping them within their treatment. I do want to step back. One last question, a little bit about integrating primary care and behavioral health. Um, as you see it, how can screening and assessment for behavioral health conditions be built into primary care appointments? Can you speak on that at all?
Yeah. So the assessment part of it's probably the biggest crucial part, and then so up front, like when we're talking to the individuals and their loved ones and family
Hmm.
members, sometimes up front we'll have to ask the families, because what are you willing to, what are you not willing to do as far as uh, supporting their loved one. And with the the identified patient coming in when we do the biopsychosocials and screenings, so we do a very comprehensive assessment to really triage the situation. So it's more of an action plan at that point. And then we develop a treatment plan, but within 72 hours, we reassess.
Reassess.
And
Absolutely.
so what we do on the detox protocols and stuff like that, we have our doctors, they're
Hmm.
24/7. We have our nurses and our psychiatrists on staff. So what we do is we don't, on the assessment, we just triage the detox and And it's just kind of like, say, something comes up because it's an individualized treatment plan at that point. And if there's like a mental health issue or anything like that, you know, we're kind of blessed in the fact clinically we have our psychiatrists on staff, so we can, you know, reassess at that point, and we can do it daily. We could, you know, sometimes we'll be running the groups. The assessment as far as the family dynamics that integrate with that, that means we're kind of working within the family. So we actually have our family dynamics. We have Dr. Angela Channer, we have Dr. Giesler, we have Dr. Weidenbach. We were just very blessed with some good talent. And what we can do is do individuals with the families. So maybe we bring somebody in that had lost her father and the mother's grieving at
Oh,
the
yeah.
same time.
Yeah.
So she's suffering in silence. So Johnny's not going to get all the help he needs because mom's,
Because
you
you don't
know,
have the
triggered.
support.
And for sending him home, it's just going to kind of be so. When I say we treat the whole person, the biopsychosocials, we're actually working with the family as well. So a little love, you hear it goes a long ways.
Yeah,
But not
absolutely.
only that, it kind of like that countertransference, like we're talking about right now and stuff like that. It's just that when we bring them back together, you know, and we'll do this while Johnny's in treatment or something, and you can see the shift,
Yeah.
right? And then so that shift is going to break off to Johnny's kids. When mom's secure in her recovery, it takes away the insecurities.
Absolutely.
And so now we have some intergenerational patterns shifting for the next generation. So the longevity is us following through with that step down program, the alumni we talked about. It kind of builds a foundation for them to feel secure. You know, like Christmases are starting to change.
Yeah.
We see a pattern of maybe somebody enrolling to college, the kids, you know, not so much regressing in fourth grade.
Absolutely.
And, you know, it's like, you know, there's a situation where, you know, if they don't have the resources, you know, like at Christmas time, we're very blessed to be able to backpacks for kids. You know, we do fundraisers with the United Airlines, sometimes the NFL, you know, a lot of people to give back to kids aging out in foster care system. So there's a lot of barriers, you know, treatment isn't just one lane. It's kind of like this whole universe where you can wrap your arms around it.
Absolutely.
Yeah.
No, that's a really exciting approach to the multi-generational issues that we see within behavioral health. So I appreciate you adding that insight. We're going to wrap up here. David, I
Okay.
really appreciate you sitting with us
Yeah.
on the Lightning Step Couch. Again, it's David Burke, founder and chief marketing officer at New Start Recovery Solutions. And you're based out of California, or where are you based out of?
So we're based out of California. We're our headquarters are in Sacramento. We have treatment programs in Monterey, Concord, as well as 4 in Sacramento, 1 in Chico, and we just got our new program that's opened up in Reno, Nevada. So
Awesome.
you can visit us at newstartrecoverysolutions.com.
David Burke, thanks for your time today.
All right, buddy.
Have a good one.